The metaphor here is that your bone marrow is the lawn, right? So the seeds are the hematopoietic stem cell, those green seeds, and those stem cells are responsible for making the green grass on your lawn. And those are essentially all the different blood types in your bone marrow that, you can make red blood cells, neutrophils, macrophages, etc. And so this is in an individual who doesn't have a RUNX1 mutation. Naturally, of course, that bone marrow, that hematopoietic stem cell in the bone marrow resides within the bone marrow microenvironment. So it's not just floating around in your bone, it actually sits in little niches, like little nests. And it's reacting and engaging with that environment. And that environment is shaping the stem cell, and the stem cell is shaping the environment. So there's crosstalk, just like soil is to a seed in the grass. Over time, in any normal individual, you can start to acquire mutations. It's a natural occurring event. Oftentimes, those mutations aren't actually beneficial to that grass seed, that stem cell, and it just dies and it gets replaced by a new healthy green seed. But sometimes, especially as we age, the chances of getting a mutation in a gene that might actually be important and be linked to cancer increases. And that's when you start to see these different color seeds here. And as we age, unfortunately, our bone marrow starts to get inflamed too, even in healthy individuals. And that inflammation is not really helping the green seeds survive. In many cases, that inflammation can help the weed seeds to survive. And now you're going to see this weed pop up, and that's supposed to represent, a clone, a hematopoietic stem cell that now has a new mutation, and it's forming the weeds, starting to start to crowd out, if you will, the green grass. And again, getting older and older, more inflammation, more weeds. And then, now, this is what we would call clonal evolution. So we're starting to see signs that this grass is not going down a good path, and you can acquire another mutation. So now you've got a really aggressive seed here that has 2 mutations, and that particular mutation can now end up driving this really nasty looking weed in just a moment. There it is. And now it's crowding out. Now we don't have much green grass left. Now you get what's called cytopenias, right? So now you don't have many platelets left, your red blood cells have dropped. Now there's signs that this green grass is full of weeds, and we're moving towards cancer, malignant transformation. And once you have all weeds, that's essentially blood cancer. And this can happen in sporadic, as we all know. People can get AML and MDS sporadically. And this is essentially what it looks like in the bone marrow. And interestingly, when you look at a patient with blood cancer, their bone marrow is incredibly inflamed. And inflammation seems to be a huge contributor to the aggressiveness of disease. So what happens in RUNX1-FPD? So RUNX1-FPD, we've got blue grass and blue seeds. So a unique lawn. And in this setting, this is just, again, a blue seed represents a RUNX1 mutated hematopoietic stem cell. For many patients, about 50% of patients, go through life without ever having this blue grass obtain or acquire any weeds. They do just fine. But sometimes we know the disease progression in many patients at the same time do start to get these bad seeds that turn into weeds and take over and crowd out the bone marrow. And so this is sort of meant to show the disease progression as we know it and understand it today. And you can see those nasty weeds coming up at the end. So what we know about RUNX1-FPD, of course, is that compared to the general population, there's a 30-fold increased risk of essentially having a lawn full of weeds, unfortunately. So of actually progressing to MDS or AML or even another blood cancer.